The silent and dangerous consequences of the contraceptive implant you absolutely need to know. Hello, everyone, and welcome back. Today, we're going to talk about a very important but often overlooked topic, the contraceptive implant. This method is often praised as one of the most effective forms of birth control, and many women choose it because of its convenience and reliability. But just like every medication or medical procedure, it comes with its own set of effects, some positive, others potentially harmful. The sad part is that many women are not fully informed before choosing it. So let's sit down together and really break this down in plain, everyday language. First, let's understand what contraception actually means. In simple terms, contraception is anything that helps prevent pregnancy. There are different types of methods available. Some are hormonal, like the pill, the injection, or the implant itself. These work by using synthetic hormones to stop your body from releasing eggs or by making it difficult for sperm to reach the egg. Others are mechanical, like condoms or intrauterine devices, IUDs, which act as physical barriers. There are also natural methods, such as tracking your cycle and avoiding sex during your fertile days. The truth is, contraception is not a one-size-fits-all. Every woman's body is different, and the method that works perfectly for one person may not be suitable for another. Now, what exactly is the contraceptive implant? Picture something as small as a matchstick. That's how tiny it is. It's a soft, flexible rod that a doctor places just under the skin of your upper arm. This little rod steadily releases a hormone called progestin into your body. Progestin does three main things. It stops your ovaries from releasing eggs, it thickens the mucus in your cervix so sperm can't easily move through, and it changes the lining of your uterus so that even if an egg is fertilized, it won't be able to attach and grow. The implant is designed to last up to 3 years, which makes it appealing to women who want long-term protection without having to take a pill every day. On the surface, it seems like the perfect solution. But here's the part that's often left out: the consequences that come with it. Like every hormonal method, the implant can trigger side effects, and these vary widely. Some women feel perfectly fine, while others find that their daily lives are disrupted. One of the most common changes is with your menstrual cycle. Some women stop having their periods altogether, while others may experience unpredictable bleeding, spotting at random times, heavier flow, or longer cycles. The uncertainty can be frustrating and stressful. Weight gain is another reported side effect. The hormone progestin can increase appetite and sometimes cause the body to hold on to water, which may lead to added weight. However, it's important to note that not every woman gains weight. It affects people differently. Skin issues are also possible. For some women, the implant can trigger oily skin or acne breakouts, especially if they've struggled with acne before. Hormonal changes can also bring about breast tenderness, often described as a heavy or sore feeling similar to what some women experience before their periods, but more frequent. Headaches and even migraines are another possible effect. Hormones directly influence brain chemistry, and some women are more sensitive to these changes. Along with physical symptoms, mood changes can also occur. This is a big one that many women aren't warned about. Since hormones regulate not only our reproductive system, but also our emotions, the implant can sometimes cause irritability, mood swings, or even depression. For someone who already has a history of mental health challenges, this can become a serious issue. Another concern is a reduced sex drive. The implant can lower estrogen levels in the body, and estrogen is a key hormone for sexual arousal and natural lubrication. As a result, some women may notice less interest in intimacy. In some cases, the implant can also cause small ovarian cysts. These are usually harmless and often go away on their own, but they can cause discomfort and worry. Since the implant is inserted under the skin, there is also the possibility of issues at the insertion site, such as swelling, bruising, infection, or even movement of the implant from its original position. One more important point that many women don't realize is what happens after the implant is removed. While fertility usually comes back quickly, for some women it can take a few months before their cycle returns to normal. This does not mean permanent infertility, but it does mean your body may need time to adjust. So, what's the main takeaway from all of this? The contraceptive implant is indeed very effective. It's one of the best options available if you want to prevent pregnancy for up to 3 years. But it is not perfect, and it is certainly not for everyone. Every woman considering it should sit with a qualified doctor, look carefully at her own health history, consider her lifestyle, and weigh the pros and cons. No birth control method is completely free of side effects. What matters most is being informed, listening to your body, and speaking up about any troubling side effects. At the end of the day, knowledge is power. The more you know about your body, the better choices you can make for your health. So if this video helped you, please share it with another woman who might need this information. Together, we can make sure no one is left in the dark about something as important as reproductive health. Don't forget to like, subscribe, and share.